Drug and alcohol misuse and abuse. How to manage the patient. Drug addiction is the prolonged, repeated misuse of any substance, a chronic, compulsive need to use drugs deposit they're causing the user physical harm. Psychological dependence is rooted in the belief that the drug is needed to maintain a state of well being. Physiologic dependence results from biological alteration in the user brain from consistent drug use. Addiction comes in all shapes and sizes and does not discriminate. Meet Bob, a well dressed businessman, fairly new patient to your practice. The dentist has seen him once last week. Medical history is relatively normal. TC is that he hasn't been to the dentist in a while and thought it was time. Medical history review for him is pulse 110, respiration 20, blood pressure 123 over 83, history of drug use. Says he's been to rehab once when he was a bit younger, sweating, fidgeting, dilated pupils. Medication Bob use are disulfiram 20 to 50 milligram daily and naltrexone to 25 milligram daily and vitamin B12 and these supplements. Patient said that he has forgotten to take his medication the last few days. Upon oral examination are xerostomia, bruxism, class 5 caries, periodontitis, and very harsh smell of alcohol.
You ask Bob if he's taken anything to help with his dental anxiety today. He states that he went out with the boys before his appointment to celebrate his friend's new position, and that should help. So, what do you do? Since Bob has a history and you have suspicions, you should gently ask Bob for further information. Let him know that drug interactions can lead to disastrous consequences. Be kind, caring, and don't make the patient feel bad or judged. If the patient, in this case Bob, is forthcoming with information, you can go from there. If they aren't, it is your decision to continue with treatment or terminate the procedure, keeping in mind drug interaction reactions and potential complications. Management. Since Bob admitted to not only drinking but snorting a line of cocaine as well, the safest method here is to terminate the treatment. The hygienist can give Bob other ways to decrease stress for the next appointment. Once again, make sure that he knows you understand and care so that he returns to the dental office for the procedures that he needs. Properly document clinical findings and suspected lifestyle in detail in the patient's chart for future reference. This procedure was terminated because the administration of local anesthetic with vasoconstrictors may result in a rise in blood pressure, which could lead to cardiac arrest. There is also a risk of convulsions associated with the combination of lidocaine and cocaine. It is advisable to postpone any dental treatment at least 6 to 24 hours after the use of cocaine. Cocaine mixed with alcohol increases all of the above effects. So, reminder, a patient who comes to the appointment in an inebriated state should be rescheduled and accompanied to their home by a responsible person. This can become a harmful situation for which the dental office would become liable if they were to treat this patient by administering injectable or topical anesthetics or performing scaling, which could induce prolonged bleeding. So, how can we help? If an alcohol dependent patient presents for dental treatment and wants to discuss their current dependency, it is important to provide a safe, accepting environment in which to deliberate. Having support materials on hand with your dental office from a resource such as Alcoholics Anonymous or Narcotics Anonymous can provide a tie to that support system. Keeping a printed list is another convenient means to help an alcohol or drug dependent patient seek help. Facts. Patients who are dependent on alcohol or drugs or who are in treatment for substance misuse present dental hygienists with complex issues. Poor oral health is common. Side effects like xerostomia, increased caries rate, enamel erosion, and periodontal disease, and poor self-care are often seen. Because addiction often results in criminal behavior to finance a drug habit, substance abusers are viewed as morally corrupt or having weak personalities who willingly engage in self-destructive behaviors that affect themselves and everyone around them. This isn't true for everyone. Look at Bob.